haven't?
No, stem cells?
Yeah.
No.
Not at all? How am I supposed to interview you? Okay, well, what's your take on it? Do you think it's ethical?
Absolutely, it's an absolute necessity.
It's a necessity?
Yeah.
Why is it a necessity?
Because stem cells are, if you get them from a fetus, they have not yet differentiated into any type of cell, which means putting them, they put in different tissues, they will become develop characteristics of that tissue.
Have you ever seen it used?
No.
No? Do you plan on seeing it used?
No.
No? It doesn't interest you at all?
Oh, sure, it interests me, but you're not going to see it unless you are either the physician, the researcher, or the patient.
Okay. How many years do you think it's going to take to advance to where it's actually used a lot? Like it's not that often right now, is it?
It's not that often right now because of the cost and the regulation.
How expensive is it?
I'm not sure what the expense is, but the regulation is what's holding it back, because in the United States you can't do any fetal stem cell research with federal money. It has to be only private money.
Because people find it unethical, or?
Because there's a question as to how you come about having fetal cells in your possession.
Okay. And what, how do you get those? Does the child have to be brain dead, or?
No, abortions.
Oh. Okay. So you would recommend the use of it, obviously, since it's a necessity. And where are the main places they come from?
The best fetal stem cells would be from the cases that they're treating would be the brain. Early on in early embryo, any part of the embryo.
Okay, so you can pretty much take from anywhere in the baby?
No, it's not a baby, it's an embryo.
Okay. And what are the main things that it's used to treat?
Right now, Parkinson's they're looking at, and the other is cystic fibrosis. And then the latest research is on diabetes, type 1 diabetes.
Has it been majorly successful, or did
No.
No?
No.
Not at all? Or
Well, of course successful, but not majorly successful.
is it going to be eventually, do you think?
Well, it will be. It will be. It's going to take a while.
How long do you think that'll take? Decades?
Oh, no, I would imagine within the next 10, 15 years.
That's not bad. Thinking of
No.
how medicine's going.
It's expensive. It's not easy work. The problem is just because you use stem cells doesn't mean that the cells are going to do what you want them to do. Because the cells are influenced by the environment in which they're placed in.
So it's not like a sure thing when you
No, there's nothing to sure that.
Oh. Do you think they'll be able to somehow get it to be a sure thing, or is that
No.
just going to be impossible?
There's never a sure thing. It's just high probability
Oh.
of success.
So what are the main benefits in society, in the future? It's going to be able to cure things like Parkinson's if it works correctly? Or?
It would have probably a very high cure rate or a high rate of preventing progression.
And cancers as well?
Well, cancer is a completely different story. We're already doing that with cancer by ablating bone marrow cells and doing bone marrow transplants. You're transplanting stem cells already, but they're adult stem cells. Adult stem cells have limited capacity to become other types of cells, whereas embryonic stem cells can become anything.
And they're just harder to get.
But yeah, because you have to have an embryo, and you're only going to get an embryo through an abortion.
And can anyone donate stem cells from bone marrow if they're older?
Sure.
Do you have to be viable though? What are some things that would take you out of doing that?
Being a drug addict, having a blood-borne disease, having an infectious disease that's that is chronic,
Alright.
hepatitis,
Yeah.
HIV.
Okay, that should be it. Thank you.
You got it.